Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. When your imaging exam is finished, you probably think the process is over. You get dressed, leave the department, and wait for your results. But behind the scenes, an incredible journey is just beginning. Today, we're following your medical images from the moment they're created until they help your healthcare provider make important decisions about your care. The moment your examination is complete, your images become digital medical records. Depending on the type of imaging you've had, there may be just a few images or several thousand. Every image contains valuable clinical information. Before they're sent anywhere, the technologist carefully reviews them to ensure the examination is complete and that the images meet the quality standards needed for diagnosis. If additional images are required, they're usually obtained before you leave the department. Once your examination has been completed, your images are securely transferred through the hospital's network to a system called PACS. PACS stands for Picture Archiving and Communication System. Think of it as the digital library for medical imaging. Instead of storing films in large filing rooms like hospitals once did, today's images are stored electronically, allowing authorized healthcare professionals to access them quickly and securely. In many healthcare systems, your images can also be shared with other hospitals or specialists involved in your care. Next, your examination is assigned to a radiologist. Radiologists are physicians with specialized training in interpreting medical images. They don't simply glance at a picture. They carefully review every image, often comparing it with previous examinations, measuring important structures, adjusting image settings, and looking for findings that help answer the clinical question your healthcare provider asked. Every report is built from careful observation, medical knowledge, and clinical experience. After reviewing your images, the radiologist prepares a diagnostic report. Most radiologists use advanced voice recognition software to dictate their findings. The report describes what was seen during the examination, highlights important findings, and answers the clinical question whenever possible. Before the report is finalized, it's carefully reviewed for accuracy. Once complete, it becomes part of your medical record and is sent electronically to the healthcare provider who ordered your examination. Not every report follows the same timeline. If the radiologist identifies a finding that requires urgent attention, they don't simply finalize the report and move on. They'll often communicate directly with the treating healthcare team to ensure important information is received as quickly as possible. This rapid communication plays a critical role in emergency medicine, trauma care, stroke treatment, and many other urgent situations. Once the radiologist has finalized the report, it's securely sent to the healthcare provider who requested your examination, but the report is only one piece of the puzzle. Your doctor combines the imaging findings with your symptoms, medical history, physical examination, blood work, and any other relevant information. Medical imaging helps answer important questions, but it's most valuable when considered alongside the complete clinical picture. One of the most common questions patients ask is, why can't someone tell me the results right away? Although the images are available almost immediately, interpreting them takes time and careful attention. The radiologist needs to review every image thoroughly and prepare an accurate report. Your healthcare provider then reviews those findings alongside your overall health before discussing the results with you. Taking the time to review all of the information helps ensure you receive the most accurate explanation and the most appropriate next steps. Sometimes, the most important part of your scan isn't what it shows today. It's how it compares to your previous examinations. Radiologists often review earlier imaging studies to determine whether something has changed, stayed the same, improved, or progressed over time. Comparing current and prior images helps identify subtle differences that may influence diagnosis and treatment decisions. It's one reason why your previous imaging history can be so valuable. Artificial intelligence is becoming an important tool in medical imaging. In some healthcare settings, AI can help prioritize urgent examinations, highlight potential abnormalities, assist with image quality, or automate certain measurements. But it's important to understand that AI doesn't replace the expertise of healthcare professionals. Radiologists remain responsible for interpreting medical images and making diagnostic decisions. AI is best viewed as another tool that supports the healthcare team while helping improve efficiency in patient care. Your medical images don't simply disappear after your appointment. They become part of your ongoing healthcare record. If you need imaging again months or even years later, your healthcare team may be able to compare those studies with today's examination to better understand changes over time. Each examination becomes another chapter in your health story, helping guide future medical decisions whenever imaging is needed again. By the time you leave the imaging department, an entire team is still working behind the scenes. Technologists ensure your images are complete. Secure computer systems transfer them throughout the healthcare network. Radiologists carefully interpret every examination. Healthcare providers combine those findings with everything else they know about your health before developing a plan of care. Every image tells part of your story. It's the expertise, collaboration, and dedication of the healthcare team that brings the whole picture together. Thanks for watching in the Know Medical Imaging, where we make medical imaging easy to understand. If you enjoyed this video, please like, subscribe, and share it with someone who's curious about what really happens after a medical imaging exam. We'll see you in the next one.